Hi everybody, I am Dr. Zainab Vora and I have with me Dr. Neeha Jhala who has cleared her DNB radiology practicals. Many congratulations, Dr. Neeha. Tell us about yourself. How has, your 3 years journey been like?
Thank you so much, Masli. I'm actually a post MD DNB student.
All right.
So my residency, I have completed my residency at DY Patil Pune,
Mm-hmm.
and currently I'm working as an SR at BJ Medical College, Ahmedabad.
Okay.
So my preparation for DNB practical exam per se, I did not get a lot of time to study.
Mm.
I was more scared about having passed through the MD exam once. I kind of knew about the cases and all.
Yeah.
But there was a lot of stigma around this whole DNB practical exam, and it
Yeah.
is tougher than MD. So I was in two minds whether to give this exam this time or just leave it because I did not get a lot of time to study.
Mm.
But then I decided to complete it along with my work because I'm getting to see a lot of new cases and a lot of variety of cases here at BJ.
Yeah.
So then I thought, like, just 2 weeks before my exam, I thought that okay, just let me give it a shot.
Yeah.
So I think the only difference between MD and DNB per se is that there are OSCEs. So
Correct.
I was really scared about the OSCEs. So I thought
Mm.
it was really important to prepare and how
Yeah.
to go about the OSCEs. So I think on Conceptual, I saw all your videos of the cases that you have discussed, all videos
Mm.
of the OSCEs, previous year OSCEs that you have discussed,
Yeah.
and all your, the points that you have emphasized, that what all to remember and what is important from OSCE point of view. So I practiced the OSCEs, and then for IR and some I
Mm.
watched your table viva videos, IR videos
Yeah.
pertaining to what practically they could ask for the DNB
Mm.
exam. And the cases to, like, I left it on my practical work
Yeah.
or whatever work I had done it in my residency and during my
Yeah.
SRship. So I just left it because to everyone who's going to give DNB, I just feel like after I gave the exam and moreover after the results came, I really think that it's not about coming to a diagnosis, but it's more about the approach and how you
Absolutely.
approach
Yeah.
a case because
Mm.
nobody wants to know the diagnosis.
Yeah.
Everybody, all examiners, or even in real life, I feel the approach is more important than
Absolutely.
the
Yeah.
diagnosis. So I first emphasized on the OSCEs, and then cases. I think if
Mm.
you have worked enough in your residency and
Yeah.
in my SRship, it is more
Mhm.
important.
Yeah. So what were the cases that you got?
Ma'am, in my long case and short case, I got invasive aspergillosis as one of my long case, and the second case was mastoiditis and complicated through sigmoid plate erosion, sigmoid sinus thrombosis, and
Correct.
cerebellar abscess. Those were my long cases,
Yeah.
and a lot of short cases were shown to me.
Mm.
I think 8 to 9 short cases were shown to me.
Okay.
I think four were mentioned, but
Wow.
in every table I got three short cases.
Wow.
So those short cases were also, I
Mm.
remember one was extralobar pulmonary sequestration in a child, then one was diaphragmatic hernia, one was tuberculoma, NCC, ACA, ACOM aneurysm, and they would only ask. The one difference I thought between MD and DNB was that the questions also which my examiners asked were more pertaining to reporting. Like,
Mm.
for example, it's a very simple case, ACA ACOM aneurysm, but what would I report?
Yeah.
The ratio, the dome to neck ratio, or
Mm.
whatever is like useful for the
Mm.
clinician.
Correct. So it was not just, theoretical knowledge, a lot of it pertaining to day to day, what you've done in the residency. Right. Nice. How was your OSCE eventually? Do you think whatever you had prepared was enough?
Ma'am, I think my OSCEs did not go well. That's what I thought. But
Yeah.
when my results came, I thought, like, retrospectively, when I see
Yeah.
it, it went well.
Yeah.
Because
But it's just the fear of, something new. That was the only thing, I guess. Otherwise, it's as good as doing spotters, the cases are very similar.
Now I feel that it is actually more valuable and easier than spotters because
Yeah,
you have three other questions to help you
correct.
come to a diagnosis.
Absolutely. Because it gives you a clue, that what are you trying to ask. So that way, even if you know some part of the question, you get half of the marks that way. Right.
I felt it was a wholesome exam.
Yeah.
Everybody tested different sub subjects of systems of radiology, so it was a very
Yeah.
wholesome exam.
That's nice. So basically, if you have to compare your MD exam and DNB exam, which do you think is tougher?
I feel just because DNB tests you in
Hmm.
all subsets of this
Yeah.
subject, I would say DNB is tougher in that sense.
Yeah.
But then I feel like it's okay. If you're
Which
working in residency,
Yeah.
then it's not difficult.
So both of them essentially check how, you've overall performed during your residency or exposure to cases. So more or less you put them at par, and more thorough exam basically would be DNB. Right. Right. Nice to know. What was your exam center?
Ma'am, my exam center was Calcutta.
Okay.
It was, I can't recollect the name of the hospital, but it was Calcutta.
Right, right, right. Okay, amazing. So how is your SR ship going?
It's going amazing. I'm getting to see a lot of cases. I'm
Yeah.
strengthening my basics. So I'm really enjoying my time with my batchmates, my juniors, my professors,
Good. That's
everybody.
amazing.
I'm getting to learn from everybody here.
I've
So
never seen a happier senior resident in my life. That also in the first year. So very happy that you are taking it in your stride, because usually when people take up SRship, that the tendency is not to learn more. It's just कि काम निकले
um,
जैसे भी. But yeah, it's good that you have come here with the approach to learn, and that should be the right thing, because after MD you don't really feel that you are ready to go out there in the world and start your own practice.
I
Yeah,
think it's a process. When I've
absolutely.
decided to become a doctor, I'm
Yeah,
just going to learn at every step of my life. So this SRship period also helped me with my exam because it made me more confident during my MD. So
yeah,
we did not finalize scans as third years. We always had a senior resident or our professor who
yeah,
overlooked our scans. Even though
absolutely.
it was perfect, we always had that final press would be by somebody else. So
Yeah,
when I came here, I became more confident
yeah,
reporting and with my, diagnosing
amazing.
confidence. So that
Are
really
you,
helped me for my DNB.
just one last question, are you still using eConceptual?
Yes, ma'am, I'm still using the conceptual because I feel like it is more practical in day-to-day routine or
Yeah,
in day-to-day just like approach to a case and
yeah,
as so if I come across a case which needs like thinking or like which
mm,
needs on how to reach a
yeah,
diagnosis, I do refer to the videos, especially MSK videos also I refer
yeah,
to it a lot.
yeah.
So it really brushes up my knowledge, and ma'am, I still have to give my FRCR part 2B.
Amazing.
So
Wow.
then I am it the RCR
Yeah.
videos on eConceptual are also
Mm.
helpful.
Right, right, right. Thank you so much, Neha. And because you've given almost every exam which there is to give, if there is any feedback, that what else can we do on e-conceptual that would make the process of learning for a resident simpler, please, feel free to tell me, and we are all ears for the feedback. So if there's anything you feel can be more, useful in the app, is there anything that you would want to tell?
As of now, ma'am, I can't think of anything, but I really like the case-based approach that you are coming up with. Every faculty is coming up with
Yeah.
case-based approach because that's what is necessary for so that we can become better clinicians in general because that how pathology medicine surgery can help us in our diagnosis and what they need and what we need to keep in our reporting, all that is necessary. So if you can incorporate that also sometimes,
Sure.
like how
Thank you.
to
Yeah,
how to report along with like studying and giving exams.
correct. Correct. Sure, surely. Basically, it's becoming more and more clinical, right? Gone
Yes.
are the days when, we can just write, do clinical correlation. You don't want to write that. We want to correlate and give a
And give
case.
them, yes. Otherwise, how are we being helpful?
Yeah, true. So, and overall learning is very, very important that, you have to be clinical radiologist. And that's what FRCR also focuses a lot on. Our exams also, DNB now by the looks of it is focusing a lot on it. But FRCR always has focused a lot on knowing the before and after of the radiology also.
Especially, ma'am, when I gave my second part,
Mm.
2A,
Yeah.
all the questions were linked to either symptoms of the patients or the
Mm.
path lab of the patient or the
Yeah.
clinical history of the patient. So
Yeah.
it's not that anybody was asking us any direct questions, which we get sometimes in NEET SS also or
Yeah.
NISS also, but it
Correct.
doesn't happen like that. It's a clinical vignette, so you have to know about everything. So that I think we still need to work on as Indian students, I feel.
Yeah, true. That's true. I think that a lot of it boils down also how you take your residency. Have you been curious enough to go back to see the feedback? What did this case turn out to be? So that's also something which is important.
Yes.
So yeah, yeah, very good point. And, very proud of you, Dr. Neha. So may you pass your FRCR also with flying colors. Wishing you all the very best and hoping to see you soon in
See
person.
you soon, ma'am. Thank you so much for all your help, ma'am.
Thank you. Bye.
Thank you so much. Bye, ma'am.